Okay, so topic I'll be talking about today is treating the transgender athlete. I'm Amy West. I'm a PM&R sports medicine doctor in the Department of Orthopedics here at Northwell. So let's go to the next slide here. Okay, so what we're going to do today is first we're going to define some terminology, discuss some do's and don'ts when treating transgender athletes, and then review some of the policy and guidelines that exist about transgender athlete participation and things that you might come across, certainly if you work with teams or with schools. So to start off, there are more than 1.4 million transgender people in the United States. So they are everywhere. And if you think you haven't treated one, you're probably wrong. So we're finding that the numbers are actually increasing as more people are sort of asking and more people are made aware. So it's something to take note of, that there's more than you think. So first we'll talk about some basic terminology. First thing that we're going to talk about is the idea of gender versus sex. So gender, the way I think about it is sort of what's between your ears. So as identified on this gender-bred person diagram, gender is sort of, what you believe yourself to be, whereas sex is defined as what's between your legs, essentially genetic, the genitalia that's present. And then separate from both of those things is sexual orientation, who you're attracted to. This is somewhat almost completely independent of sex and gender. And then there is gender expression, so how you present your gender, what you dress as, how you interact with people, etc. And to keep in mind that all these things are on a spectrum. They're not necessarily binary, male or female, or masculine, feminine, gay, straight. There's sort of there is an in-between space, and people can kind of be anywhere on the spectrum. It doesn't necessarily, you don't necessarily have to choose one side or the other. And another terms to be familiar with, the idea of cisgender and transgender. So both of these are adjectives. These are not nouns. But cisgender is someone who describes a person whose gender identity aligns with their sex assigned at birth. So born as a female, identifies as a female, and presents as a female. Transgender is someone who describes, it describes a range of people who experience or express their gender in a way that does not match their sex assigned at birth. And that's the subject of this talk today. So the gender transition process has many steps to it, and it can vary greatly amongst different people. Some people do some of these things, some of these people do only one of these things, and not necessarily everyone who's in a gender transition wants to do all of these things. So for the first step in the process usually is social change. So someone dresses in a different way, or goes by a different name, sort of comes out to people around them as a transgender person. And then the next step in the process, should they choose to do it, is a medical transition, which would involve potentially hormonal medication. And then there's also surgical options, which include top and bottom surgery. And again, it's not something that necessarily people always do or even want to do. And like I was saying, every person's gender transition is different. So that's why there's not necessarily a roadmap as to exactly how it goes, because everyone is different and everyone chooses to do different things in this process. So we'll go over some do's and don'ts, because words really matter. So when dealing with the transgender population, when you're treating them, something that's very important, and a way to show that you are aware and that you care is by using correct terminology. So don't use terms like this. So like biological sex, or talking about someone's real name, referring to someone as a transsexual. That's kind of an antiquated term. But instead using these terms, so instead of biological sex, saying someone's gender assigned at birth, or instead of saying someone's real name, use their birth name. Or similarly, calling someone a transsexual, you call them a transgender person, because the word transgender is an adjective, not a noun. So just paying attention to things like that. Or more importantly, if you hear other people kind of using these terms, sort of saying, well, this is the kind of correct term, if you will. Another thing is make sure to use correct pronouns. So pronouns are very important for transgender people. And the way to make sure that you're using correct pronouns is essentially just making it part of kind of your everyday routine. So present your own pronouns. So like, for example, on your name badge or whatever, there's, you can get stickers that say, it's my name and my pronouns are, and it's pretty much been standard across the board. Then there's really no way to kind of make anyone feel left out or make a mistake, really, because it's all kind of just there as part of the process. So you present your pronouns, you just ask everybody, and you make it standard on your evaluations. In your evaluations on your intake forms, like this one that's from the University of British Columbia, just sort of, it's just another question: name, date of birth, gender pronoun, and it's just, if you ask everyone, then no one feels kind of left out. Another thing to not do is dead name. So dead naming is when you refer to a transgender person by the name they used before they transitioned, and that can hold a lot of emotional kind of weight to it. So you want to make sure to always call someone by their correct name, and especially if you're working in the high school population, you might know someone by a certain name and a certain gender one year, and then the next year it's different. So to just make note that you're making the effort to use the correct name and refer to people how they want to be, and the way they want to be referred is important. And then just don't assume anything. If you have a question, ask. That's a way to kind of reduce mistakes being made. Another thing not to do is just in general, when you're dealing with a group of people, don't assign a gender to an inanimate object. So, calling a group of kettlebells, go grab those guys over there, or, assigning a gender to things that doesn't need to be gendered. Sometimes we just do that, but we just gotta be a little more mindful about when you're doing that. Similarly, when you're addressing a group of people, don't call, hey, you guys, we're gonna go over here, because it's kind of gendering a group of people, because that can really offend someone who doesn't necessarily want to fit into that term, even if you're saying it very innocently and not really giving it two thoughts about it. It can really make people uncomfortable. Similarly, if you have a workout standard or a certain kind of exercise you're doing, it's like calling things male push-ups and girl push-ups or whatever. There's not necessarily a male versus female, men versus women kind of thing. It's just, this is one way of doing it, this is a standard, and this is a scaled way of doing it, or this is an advanced way of doing it, and this is a beginner way of doing it. But when you start assigning gender to it, it gets a little sticky, for not just transgender people, but for everybody. So there's kind of no need to do it. So things to remember to do. So respecting your confidentiality of an athlete. So certainly if you're an athletic trainer, someone who works in the school with you, and an athlete says, essentially comes out to you as a transgender person, you want to make sure that they're cool with you telling other people before you do that. Just as any medical condition or any other issue, you want to gain trust by not telling people things that they don't want out there. And a tip that I've received actually from a transgender athlete is that if someone comes out to you as transgender, something that's really nice to do is to thank them for telling you that. So, thank you so much for telling me. I appreciate that, you sharing that with me. That's actually goes a really long way. So that's another good tip. When you're doing an exam, be very specific about it. Touching things that only need to be touched, exposing things that only need to be exposed, and then also, asking, explaining what you're doing, but then also asking, is it okay if I touch this or uncover this? Because that can be kind of tricky. Someone that I know is a transgender athlete had issues with people touching around their chest or using a stethoscope, even, because it was just too close to their chest, and they were very sensitive about that. So, things like that you just want to be very kind of clear with what your intentions are, and explain yourself. Similarly, you want to treat the anatomy that's present. So, a certain, requiring certain protective gear for certain areas. You have to kind of know what's there so that you can treat it. So asking questions and in a respectful way is a good way to do that. And that kind of goes into the next tip, is having open line of communication. So, if you ask somebody, I'm asking you because I want to make sure I give you the best care possible, being very clear about it and non-judgmental. That's really the best way to make sure that everything's getting addressed and that everyone feels comfortable with the situation. And, lastly, like acknowledging, like if you say something that you think is offensive, or, you say something incorrect, just kind of saying, okay, I think I may have said something that was offensive. I apologize about that. Let me know if I do it again. And, just moving on, just like, let's not be awkward about it. Let's just kind of get on with it, acknowledge that you messed up, and move on, because I think it's a learning process for everybody, right? So moving on to the sports participation guidelines. In New York City, the guidelines are such that, students who are transgender basically can participate in sports and physical education in accordance with the identity that they assert at school. So, and then when it comes to competitive athletics, it's basically treated on a case-by-case basis. There's just a map here from transathlete.com, which has sort of, it explains the different policies. If you're interested, you can kind of go and look by state, and they kind of grade them based on, kind of the restrictive level and what's considered friendly versus not friendly. And so in New York City, it's sort of a case-by-case basis, but in general, students can participate how they identify. As far as locker room policy is concerned, transgender and gender nonconforming students must be provided with an inclusive restroom, or a facility that's consistent with their gender identity at school. And the schools must make a reasonable effort to accommodate for this, for anyone's desire for increased privacy. So in general, people can use the locker rooms they want to use, or they have to be provided a space where they feel safe. So that goes for everybody. So just another policy to make note of. Is New York State, which I believe the Long Island schools follow this policy, but I think every school is different. And again, these are guidelines; they're not actually actual like laws. So schools these are sort of served for the schools to make note of, but they don't necessarily have to follow any of these things. But essentially, in New York State, students who identify as transgender have to tell the superintendent. Then the superintendent, makes it known for the school. They will use the gender identity for registration, medical documentation, and then there's this term that kind of is a little confusing, but to determine eligibility to play certain sports, there has to be they have to identify if there's a gender identity related advantage. So what that means exactly is as clear as mud, really. These are, again, it seems to be on a case-by-case basis. It's a pretty vague rule, doesn't really make it not very clear. So again, these schools are not required to even follow this. It's good to know if the school that you're working with has a policy. Let me go forward. So for the NCAA, for trans males, so female to male transition people, in order for trans men to use testosterone, they have to get a therapeutic use exemption. They also may compete on any men's team, but they cannot compete on a women's team without the status being switched to a mixed team, which mixed teams don't really have a place in competition. So what that means, again, is kind of vague. But if they're not taking testosterone, they can participate on a men's or a women's team. For trans females, they must be on testosterone suppression for over a year, or a year or more, rather, to compete on a women's team. If they are not on any kind of hormonal treatment, then they cannot be on a women's team currently. So here are some resources, transathlete.com, athleteally.com, if you have any questions about policy or rules or how schools can get involved. These are good resources. And conclusions, so essentially, choose your words carefully, because words matter and words can really empower or offend people. So being aware of what you're saying. If you're making inclusive language standard and inclusive policy standard, then there's really no way to veer from that. So just sort of incorporating it into your everyday work. Be knowledgeable of your school's policies and guidelines. They vary, and depending on where you are and what if it's a public school, private school, New York State, New York City, somewhere else, all these rules are very different, and having an understanding or at least a knowledge of them can be helpful should a situation arise. Next thing is, don't be an a-hole. It sounds pretty simple, but if something sounds like it's rude or offensive, it probably is, so don't do it. So just think about what you're saying before you say it. Don't say anything that you think might be offensive, because it probably is. It's kind of standard rules about like being a human being, but just also, if you see other people saying or doing things that are probably not okay, other students, maybe as someone as in some kind of authority, stepping in and saying something before it becomes a bigger problem. And lastly is asking for help. So, these policies are kind of ever changing. The research is always evolving and new stuff's coming out by the day, and not many people know a lot about it. So certainly if you're put in a position where someone's asking you about eligibility or participation or locker rooms, and it's something that you need to get more people involved to help you make a decision and help you figure things out, because it's bigger than just one person. So certainly asking, someone like myself who's fairly well read in the subject, there's still a lot of things I don't know about it. So, bringing in help, administration, physicians, etc. And that's it. So there's my email. Let me know if you have any questions, and hope you enjoy the talk.